Today we're going to talk about root canals and the jaw infections and the controversy that root canals are connected to a systemic disease. We have some facts. There is nothing set in stone regarding that subject, but some facts are. What is a dental abscess? A dental abscess is usually a collection of dead tissue, white blood cells, and bacteria. This bacteria that's found in an abscess around a root canal treated tooth is mostly gram-negative bacteria. Another fact is that gram-negative bacteria, they have something called lipopolysaccharides. Lipopolysaccharides is an endotoxin. And lipopolysaccharides have been associated with diseases, chronic diseases, autoimmune diseases, sometimes very serious conditions like cancer. There are papers that we're going to take a look at the initiation and progression of cancer. Again, further studies, they need to be done in order to confirm this, but we're going to relay the facts in this video. Lipopolysaccharides is found in almost all root canals. They found out also that conventional root canal treatment could not eliminate lipopolysaccharides. Another study found that ozone-assisted root canal treatment could not eliminate lipopolysaccharides. They found also that when you put the gutta percha to fill the root canal, which is a material used in root canal filling material, also it helps push those lipopolysaccharides beyond the root surface. There's another study that also links polysaccharides to initiation and progression of esophageal cancer, a cancer of the esophagus. Another study showed a relationship between lipopolysaccharides and a lot of autoimmune issues. And it depends on how big the abscess is and how large the amount of this bacteria. Polysaccharides have also been related to colon cancer. People have to understand that all chronic diseases, they're not caused by one thing. A lot of things are involved in autoimmune disease or any serious illness or any chronic disease. The nutrition, the body's ability to heal. So it's not only one factor. So many things has to be combined in order for someone to have a serious systemic disease. Does everyone with a root canal get those? No. So depending on the severity of the infection, on how the root canal was done, the studies show there's always a number of lipopolysaccharides. But we have a very strong immune system too. So many things have to be combined. Stress also is a factor, decreases the immune response, and it's a known fact. The idea is to try and find a link and to see if there is association between infected root canals, and again, I say infected root canals. I had a patient that came in a month ago, and she had really a big abscess around an obviously root canal treated tooth, two teeth actually. Usually the process or the common protocol for that patient is to do something called a retreatment with an endodontist. You can see on the dark area on the slide is very large. I think it takes a very strong immune system to really, even after doing the root canal, to overcome this. So again, we said abscess has dead tissue, has white blood cells, and has gram-negative bacteria, which has lipopolysaccharides. So all this dark area that you see has all of that combined. The patient presented with a case of ovarian cancer that was removed, and she had chemo and radiation, and she came back. That was done in December. Cancer came back, different part of the body, in the uterus specifically. And I believe that based on all what we said, we have to take care of that to help the body heal from this. We have to take care of that abscess. We took the tooth out and we made sure, as you can see in this picture, there is a curette, a surgical curette, where we clean and scoop out the infection. And we went way beyond where the root tips are, where the bone was destroyed by this abscess. And the tissue that we got from there is what you're going to see in this picture. It's amazing to think that any treatment can actually get rid of all of this dead tissue and all of this bacteria. I believe that that patient has a way much better chance of fighting any systemic or any chronic disease if this was taken out, but was taken out properly. All of this area should be cleaned, infection should be scooped out, and the area needs to be disinfected, preferably plasma placed in there, some bone, some mineral kind of bone to replace this huge amount of bone loss. The patient was put on antibiotic, and antibiotic are needed. A lot of people, they don't want to take antibiotic, but in some cases, antibiotic, especially when we're dealing with an infection like this, can be life-saving. Anything that is natural has not been studied enough to replace antibiotic when you're doing a surgical extraction for infected tooth or an infected root canal.